Introduction to Visual Acuity. Visual acuity allows a practitioner to gauge a patient's general vision. Visual acuity tests the second cranial nerve, the optic nerve. So, in testing visual acuity, it must be reliable and accurate, as it is commonly used to track changes in vision, whether an individual's vision has improved or deteriorated. Before we begin testing visual acuity, there are some things we need to set up. The patient must be 6 meters from the Snellen chart. If the room is not large enough, we can use a reverse Snellen chart and a mirror set at 3 meters from the patient. A normal Snellen chart has random letters arranged in diminishing size. If the patient has glasses, ensure that they are wearing them. Furthermore, ensure we test each eye individually by covering the other eye with an occluder or with their own hand. Ask them to read the lowest line they can on the chart. Here, Frank can read P, E, C, F, and D. To report the patient's visual acuity, we report it as distance from chart over number next to lowest line read. Note that if Frank could only read less than half the line correctly, take the line above as his lowest line. In this case, Frank scored 6/12. This means that he needs to be 6 meters from the chart to read what a person with normal vision can read at 12 meters. Therefore, normal vision is defined as 6/6, also known as 20/20 in countries that use the imperial system. For Frank, 6/12 vision implies abnormal vision, either caused by a refractive error, where the eye does not focus properly, or is caused by an underlying problem with the eye. As refractive error is easily corrected by spectacles, we can determine if the abnormal vision is due to a problem with the eye by performing a pinhole test. Place an occluder with pinholes over the examined eye and ask if they can read the line below. If the patient's vision improves, the abnormal vision was caused by a refractive error and should be referred to an optometrist. If there is a problem with the eye, the patient's vision will not improve with the pinhole test and should be referred to an ophthalmologist. Here we have Sharon, and she is struggling to read the top line on the Snellen chart. To continue testing visual acuity, check their ability to count fingers, perceive hand movements, or even perceive light. Here are some reminders. The patient must be 6 meters from the Snellen chart. Ensure they are wearing their glasses. Test each eye individually. Read down to the lowest line. Report visual acuity as distance from chart over number next to lowest line read. Now it's your turn. Here we have Simone. With her left eye, she can read L, P, E, D. What would you report Simone's visual acuity as? Pause the video before we reveal the answer. The visual acuity of Simone's left eye is 6/15. You now know the basics to testing visual acuity.